welcome to 10,000 Steps with Baby. I'm very excited today because we're talking about a topic that is close to my heart and I just think is incredibly interesting. And we are lucky enough to be joined by Dr. Mariana Colmenares, who is a paediatrician by background, and now she is one of the rare breastfeeding physicians in the UK, and she's also part of the Global Breastfeeding Clinic, which is in London, which is trying to improve access in the UK to the sort of area of forgotten postnatal medicine. So she is both incredibly knowledgeable about this whole subject from a scientific point of view, and she's also breastfed herself 2 babies. She's got the first-hand experience as well. So thank you so much, Mariana, for joining us today. Did you want to introduce yourself? Is there anything that I've missed?
No. Thank you very much for the invitation. I'm really happy to be here with you and to share. I think it will be great. Thank you.
Yeah, great. Can I just start by asking how you became a breastfeeding doctor? Because it isn't really a common thing in the UK. I'd never heard of it actually until we got in touch with each other.
Yes, it's quite interesting. I think that, first of all, I trained as a pediatrician and I've always was quite interested about, well, natural things and natural ways of approaching medicine, like a little bit more holistic way of understanding health in general. So I trained in a hospital. It was like a 3rd level. That means that we had like the difficult cases and this oncology and like very high level things. And then when I finished my training, I was out in the world looking at common pediatric in Mexico. It's quite different what you see in pediatrics. It's a lot of babies and vaccinations and things like that. So I started to get a lot into neurodevelopment. And then I was pregnant and starting to connect with what was needed after, like when babies are born, because they don't teach you anything about that. It's like you become a mother and then you're like, wow, what do I do now with all of this? And then I started reading about breastfeeding. I've always wanted to breastfeed. I always wanted like normal delivery and, pregnancy and all that. And then I got into the topic of breastfeeding and it blew my mind. Like, what is this that they've never teach me? What's this physiology and anatomy and that I never knew about? So it really helped. And helped me to get into this. And then when my daughter, she's now 16, was born, she was a great feeder. Like she taught me many of the things I now know. And she introduced me to this because things weren't easy in the beginning. And I had a lot of pain and nobody really knew what to do. So I started to go into this field and realize that there were people around the world already working in breastfeeding. And well, then I became a lactation consultant at IBCLC. And yes, I think that motherhood put me in.
I love the fact that you're saying, like, as a pediatrician, the people who study how to look after babies, you were saying that, when you were pregnant and expecting your first, you didn't know how to look after a baby as well. It's such a common thing, isn't it, that you actually don't know what to do. No one seems to know how to manage those first few weeks and months.
Yeah, exactly. You know about IV liquids, you know about pneumonia, you know about many of the things that you do as an acute pediatrician in the hospital, but not about changing nappies, not about like anything else. It makes it quite interesting and difficult and challenging for the first months, I think.
Mm-hmm. No, I mean, that was definitely what I found. It was just making up as you go along and having to ask people. Like, I remember when my son was born, it was the lady who came round and she was handing out sandwiches and hot drinks at 4 a.m. And I was like, how do you burp a baby? Are you supposed to burp the baby? And she was like, oh yeah, like I'll show you. And it's just all these people who, teach you these things that you don't realize you don't know. But talking about things that you do know, because when we met briefly, we had little talk about matrescence, if I'm saying that right, and all about the sort of science behind breastfeeding. So I was wondering if you could talk a little bit about that, because I know almost nothing about anything to do with that, which I think is true for most people, I would say.
I think that's very important because when I link this a little bit with my own experience, of motherhood and how I came into this. I realized that many of the things that happened were quite difficult in terms of like mental health in general. Although I didn't have any diagnosis of postpartum depression or anxiety or anything, but it was quite tricky. And while I was like breastfeeding and learning a lot of things, I started to get much more deeper and starting to support families with these interactions and these like first days, first month that I realized that they were usually tricky for everyone. So I started to meet people that were a lot in the like much more than me in the field, and reading about what happens in mothers. I've been always really very interested in hormones and changes, and understanding that there is a physiological phase that happens during this time in motherhood. Like it's quite like superficial when we talk, oh, became a mom, and then yeah, babies grow, babies, toddlers, and like the usual life. But then we are losing a little bit of the focus on what really happens in this period of life. That makes it quite difficult in a way, but also understanding it makes it much more easier to go through it, because it's not just our brains that need to adapt, but it's metabolism, is hormones, is the way our brain is connected. And this term of matrescence, it was by an anthropologist looking at different mothers around the world. So this happens everywhere. This happens to every mom, and even again if you have two babies. So it's this period that is compared with adolescence, and then during this period is the changes on the mom's brain, the changes on behaviors and interactions, that nature brings us closer to our babies and our puppies. So like, and we need that because if not it would be really difficult. So those difficulties that we see like in our usual things that we used to be very good on I don't know, maths, or very good on the things that we need to think about, or as professionals, but it sometimes you start to realize that you forget many things, and that you're much more connected with emotions and much more connected with your babies, and not really focusing on things that in the past matter to you then no longer matter. No, and that is all because of prolactin and because of oxytocin and because of other hormones that makes your brain change. So this matrescence is this period of change in our brains, and it gives us much more than what it takes. But I think that that's not shown to us. I think that it's quite difficult to be there without understanding that all of this is temporary. It's important. It's part of what's supposed to happen also.
Yeah, I think it's reassuring to hear that it is an actual hormonal thing, because I think we all understand that phenomenon of, like you said, not caring about things that you did before, or and if you're having a hard time with it, or you sometimes even just trying to describe it to someone else, and they just say like, oh well, baby brain, or you're tired, or you're overly emotional, and it can kind of get brushed off a little bit. So it's nice to know that there's actual biochemical reasons behind why you're feeling like that. I mean, do you think it's useful for women to know about that? Because I don't think really they tell you about any of this in any of like the sort of baby prep classes, or
No, it's usually until you're in the middle of the chaos, no, that you start to realize that something is really happening. But what I think it is really useful is to understand that this has a purpose in your life, your baby's life, and what needs to happen. And when you understand that this is a normal phase, it's much more easier to just leave it and just be, well, this is just a period. This is what I need to be doing. And this is also why I think that the reason why it's so important to know about it is that, for example, when you go to healthcare professional and they tell you like, oh, you need to feed a baby every 3 hours, and you need to do this every 5 seconds, and you need to put the baby doing, and give you so many instructions that it's impossible. And it's not that we are dumb. No, it's not that you, oh my goodness, what's happening to me that I can't remember even a series of instructions. The reason is that all of that structure and very like brain that's all rigid is completely off. It's shut up, like it's shut out. And understanding that makes it much more easier to be really connected with yourself at that time.
And when we're talking as well, just to make it clear, or to make sure I've got this right, this is just having a baby. It's not about specifically if you're breastfeeding. So even if you were, bottle feeding, you would be having this same change, wouldn't you?
Completely. And I think that's important, a very important point that you're touching now. Look, so there are many things that happen when you have skin to skin with a baby, or when you carry a baby, or when you're in the rhythm of a baby, the circadian rhythm, when you are feeding the baby on demand. So you're not putting like times and rigidity and all that. And that makes these like connected with yourself, even though if you don't breastfeed. So I think it's also important for these families that may struggle or may decide not to breastfeed or whatever happens. This situation also happens to everyone.
Yeah.
The falling of the hair in the 4th month of life, it happens exactly the same to moms that are breastfeeding than the ones that aren't. No, it's not just that.
Yeah, I see a woman with a pram and I can pretty much like age their baby by when they've got those little tufts of hair that's coming out the side where all their hair started to. And the other question I had for you, so the people that I kind of got told about when I was about to have my first baby or just after, if I needed breastfeeding support, so people were saying, you can go to your health visitor or the midwife or the GP. What's the sort of difference between those people who you can get advice from and a lactation consultant or a breastfeeding doctor?
A lactation consultant is usually a healthcare professional that's specifically for breastfeeding. So it's a person that's not just much more experienced than any other healthcare professional around breastfeeding. And usually the background of a lactation consultant can be that of midwifery or nurses or health visitors or doctors. There are a few in the world that are doctors as well. And that is like a person that should be part of the team and needs to be part of a team when there are issues around breastfeeding. Because usually midwives and health visitor and nurses usually don't have enough training around breastfeeding. It depends as well on their own experience, depend on where they trained, but it isn't like a part of every program, or it isn't part of every training to have enough information or enough training around breastfeeding. So it is. Sadly, GPs are frequently not at all knowledgeable about breastfeeding. And that's the biggest issue about breastfeeding medicine, that it isn't a topic that's taught in universities. It isn't taught in any university as part of the curriculum, which is something that around the world there has been a lot of need, first of all, and second, trying to bring this to be part of the curriculum of every healthcare professional, including doctors. And as well, it depends. There can be some GPs that are very interested in that and then can train themselves, or they can have own experiences around breastfeeding and be really good supporting. But you also have, and there's an interesting research about that, when a doctor have a bad experience around breastfeeding, usually the support they give to parents isn't the best.
Oh.
And that's natural, because if you had a difficulty with something, it's difficult to say, no, but this is what you should do, or this is the way you should do it, because yourself had a complex situation that makes it much more difficult. And it's natural for you, okay, nothing will happen. You can bottle feed and you will be fine. No, it's like, yes, you will, but you need more professional support because you want to breastfeed. No, so yeah, hopefully I answered your question.
No, that's really useful because, I had these thoughts myself because I talked about it. I did an episode on this podcast before about just my personal experiences with breastfeeding. And one of the things I talked about in that is that in preparation for my first baby, I went to the how to breastfeed class and I read the sort of advice online, but it's like learning to drive a car by reading a car manual. You can't actually do it until you try to do it. So after that experience, when I had my second, I kind of thought, the people giving advice, like if they haven't actually breastfed themselves, like I can imagine it can be difficult to give advice about something, even if you're very knowledgeable about the sort of science behind it without actually having the real world experience. I don't know how true that is. Maybe it's not true, but it just made me think about that.
I've discussed that, and I've heard people talking about that, like a personal experience. I think that personal experience really makes things different in many ways. But for example, an oncologist doesn't need to have cancer to be good
Yeah.
in telling things, no, or in supporting family. So as well in breastfeeding, you can be really knowledgeable about something, and you can support a family even if you haven't breastfed yourself. So it's not that only experienced people or own personal experienced people are better, not at all. It can give you positive things or negative in a way. But also what breastfeeding medicine tries is to make, first of all, evidence-based information accessible. And as doctors, I mean, you are from another area of medicine, but as any doctor in any area, we should know the most recent evidence to support the families correctly. So in breastfeeding medicine, that's what happens, but it's usually not as known. So I always give this example. No, if I don't know about epilepsy, for example, and I see a child that has seizures, I will not tell the parent, well, as I don't know a lot about seizures, we're not going to try the seizures. We're going to continue life. No, my responsibility will be to refer the child to the person that knows more about seizures, because that child deserves the best, and the family as well. So it's understanding that area and understanding that breastfeeding in particular matters, and matters to the family, matters to the baby, matters to the like in general. No.
Yeah, I think it's funny, isn't it? Because not just breastfeeding, but to some extent, the whole of pregnancy and labor is one of the few areas of medicine where we're still kind of happy to not have evidence base. You know, we still cabbage leaves in your bra and things like that.
Well, let me tell you that works.
Oh, okay. Well, there we go.
Yeah.
But you know what I mean? I feel like it's still one of those areas where there's suspicions, old wives' tales. You know, I think it somehow gets integrated into medicine. You know,
Yeah.
no one does that, like you say, with the treatment of epilepsy. You know, no one says put a rock under your pillow at night when you go. You know, they would say no. I want to see someone who knows what they're talking about. Yeah. But yeah, okay, that's interesting about the cabbage leaves. So I mean, that's talking about a sort of problem. That's a little segue into this, because I wanted to ask, so what are the common problems that you would be able to help with? Like, what is your bread and butter of what you see?
Well, usually as a lactation consultant, you see a lot of latching difficulties, a lot of pain, for example. Pain is one of the main reasons why moms seek for support. It's very difficult to cope with a painful nipple with all the other pains that you can have around your body when your babies are born, no? And as a pediatrician and as a breastfeeding medicine, I see a lot of children that are not gaining weight. For example, I'm a tongue tie practitioner, so I've been doing tongue tie releases for many, many years. And so I also see a lot of babies with tongue ties that can usually what happens is that, imagine like the support in breastfeeding. Usually moms and babies will not need support if they are correctly in the world. Now you have a vaginal delivery, you have a baby that's put skin to skin immediately. And I liked a lot the example that you put of driving. I use that example a lot with breastfeeding. Breastfeeding is like driving a manual car. You need to do things. It's not more difficult. It just needs a little bit of more practical things. No, you need to train a little bit. In the beginning, it might be a little bit more difficult, but once you know how to drive a manual car, many people might prefer to drive a manual car because you're under the control. Like you have, it's funnier. I prefer myself, no? And driving an automatic car might sound easy, but breastfeeding, if you don't have it in the beginning, then babies do not like practice in the place where they should. So usually I can tell you like maybe 70-80% of breastfeeding will not need any kind of support. It's just leave things as nature allows and makes it best. And doing all those kind of things, that's why it's so important, because they are preventative measures. So having a vaginal delivery is preventative, skin to skin immediately after birth, baby rooming in. So all that prevents problems. So then you have another proportion of families that may have some issues, and some of them might fix easy, just helping a little bit with a latch. Maybe it's an angle thing. Maybe just put a little baby a little bit, or the neck a bit more extended, or don't do anything and just put your baby on top of you, and baby will know what to do. But then you have another little part of babies that will need a little bit more support. Maybe it's a muscle tone, maybe is I don't know, difficult latch, maybe it's a tongue tie, maybe it's a cleft palate. And then is that area when the medical part might be useful because there could be other things that are affecting. So, for example, hypothyroidism, for example, in a mom might impact the milk supply, or PCOS, no, polycystic ovaries, might affect the milk supply, or having gestational diabetes, having a medical condition that may impact the breastfeeding journey. So, as you can see, from 100%, you may have a small proportion of families that might need a little bit more of expert support on that. And then you have on the lower end, like the very, very tiny rest of the families that may have other issues that you cannot solve. Or there isn't yet information about that, like insufficient glandular tissue, for example, that it's not very common, but it exists. And then these families usually struggle so much with weight gain, but nobody really makes a diagnosis. So those are the kind of things that me as a breastfeeding medicine doctor, like those difficulties.
Okay, and just insufficient glandular tissue, I take it that's not just talking about having small boobs, that's actually having less of the actual tissue that produces the milk. Just in case, I'm thinking if anyone's listening, I mean, that's my understanding of it, but in case someone's listening and is pregnant and is thinking, oh, I've got small boobs, is that going to be, but it's not the same thing, is it?
No, it's not the same thing. It's not the size of the breast, it's the shape of the breast. So usually in insufficient glandular tissue, which is a very interesting condition, it can be associated with polycystic ovaries, for example, but not always. And usually their breasts are very separated in between them, like more than 4 fingers in the middle of the chest. In between them usually are breasts that are to the sides, and the shape is quite triangular, not very rounded. So there are clinical characteristics of insufficient glandular tissue, which not always means that there's going to be a problem. So there are other things that we need to ask in the history, but that means that it's like, well, you might have some issues, and it's better to have the everything the best. Like everything should be like closer to be perfect, and then this issue might not be a problem or might be a problem. So that's why we should be like closely like accompanying these families.
Right. Okay. I guess that's like my next question was do people kind of come to see you when they've already developed a problem or they're having an issue, or do the people come and say, oh, I think, I'd like some extra support once the baby's born, and see you before things have happened, before there's an issue? Does that make sense?
Yeah, it varies a lot, and it depends. As breastfeeding medicine is not yet a known specialty or a good known specialty around, sometimes they are not referred. I think that every family or every woman that has any health issue that may impact breastfeeding should be seen by a medical breastfeeding physician. That would be my recommendation, because if you know that you had, for example, IVF pregnancy, and you know that the reason why you have the IVF is whatever, and then you might have much more information about that, and you can prevent different things. For example, you can prevent a baby from jaundice, or from hypoglycemia, or from not gaining weight in the first weeks, or even dehydration, or even hospitalization of a baby. So there are many things that you can prevent supporting breastfeeding. And the other thing that is very useful as well is when we see surrogate moms or adopting moms, because we are able to induce breastfeeding or breast milk to those families. So usually families will need prenatal information to make choices and to be able to induce breastfeeding, for example, in lesbian couples.
I was wondering about that because I read an article saying that there had been a breastfeeding unit in somewhere in the UK where had successfully induced lactation in the transgender partner. And I was thinking that would be amazing if there was 2 people in the relationship who could breastfeed, because that's half the load of, because breastfeeding is a lot of work. Absolutely. But then I was wondering, would the baby find that confusing? Or I'm guessing not. Babies just want the milk. But I read that article and I thought, oh wow, that's amazing that they've managed to do that.
No, it's interesting. I think that what you just told now, it's interesting because obviously breastfeeding is difficult and parenting is difficult. Yeah. So what we used to have in the past is have other women feeding the baby. So it wasn't just the mother, it other members of the tribe or other members of the community breastfeeding. So that's something that in nature has been there forever, no? Like supporting with that.
Yeah.
I think that for the years it's not a very popular experience or a very popular thing to do, but there were wet nurses, which they are called,
Yeah.
no? And people do it for money in many, like in the past when there weren't any formula and babies needed breast milk because if not they will die. They had these wet nurses, and they will have these wet nurses that do it for money, and they will take the child to their own communities, sometimes away from the parents, and then bring the babies back when they were 2 years old. Imagine that. So it, it's super interesting. The history and
Yeah.
all that, what happened with these babies were very interesting. So inducing in the partner is something that can be very helpful, and babies usually get used to what they have,
Yeah.
whatever it is. The resilience of babies is amazing. They are happy with whatever they have, if it's with love and support. So yeah.
Yeah, I was just imagining a world where if you were a heterosexual couple, that both parents could breastfeed and split. It would be a very nice world to share that load.
But now that you talk about that, it's interesting because sometimes, I don't know your own experience, you may tell me now, but usually many couples want to give bottles at night or to give bottles during other times of the day so the partner can get involved in the feeding. And I have something to say there. They can decide whatever they want, but they also need to know that the biological, like natural thing is that moms with boobs breastfeed the baby. But there are so many other things that we need as a woman in that moment of life. So it's like bathing the baby, changing the baby, playing with the baby, sleeping, like many, many other things. Because if you give a bottle at night for the partner to get involved, you might lose your supply, or the baby might get confused and might not want the breast, or might prefer the flow of a bottle and may start rejecting the breast. So there are many other caveats about that decision, and it usually doesn't make the partner closer to the baby. So that's important as well to know.
Yeah, I think we did it a few times. I think it was more like we had some stored colostrum, and Jack gave some syringes to James, and I think he liked it. I think there must be some sort of deep biology behind giving nutrition to your child in whatever form, because I know he did really like it and he felt like it was a nice way to bond.
Yes, absolutely. And something interesting, there was a research that they measured oxytocin in obviously oxytocin increases in the women, no, when they're breastfeeding, and that's completely normal and natural. We know about oxytocin a lot in women, but they measured as well oxytocin in men or in the couple, in the partner. And they noticed that the oxytocin was higher when they were involved in the parenting.
Oh.
So that's also very interesting. And they measured oxytocin in gay couples that adopted a child. And they realized that oxytocin increases with parenting, increases with having a baby close to you. So it's not just about the feeding. No. And I think that it's usually that idea that obviously feeding is incredible and breastfeeding is incredible. And it has so many good things about that the mom does and that. But there are those or other ways that also impact in the biology and also impact on the brain and on the connections, no? So it's also showing those kind of interactions that can be useful. And at the end of the day, they can decide as well to use a bottle if they want, and to give freedom to the mom. That's also important. And I think that everyone has the right to decide how they want the journey. What I would suggest is to wait a few weeks, in between 4 to 6 weeks, to establish the breastfeeding correctly from the beginning. And then you can be much more flexible later on.
Yeah, once they've got their preference for the breast, and I think that's right, isn't it? That's really nice. I like that. I mean, again, it kind of goes into what we said before about about this being the same hormonal changes for breastfeeding or bottle feeding. So you're still getting that oxytocin boost. You're still getting, because the oxytocin is that bonding hormone that you get with your baby. So just by feeding the baby in whatever form, you're getting that boost of hormones as well, which is nice and probably reassuring for people to know. Are there some normal things that you get contacted about by new mums that are not anything to worry about? Or do you ever say to someone, you don't need me.
Yes, absolutely. But as a lactation consultant, is a first of all, I think that it's very important for families to understand what's normal. And in general, even as a pediatrician, I do, I'm a community pediatrician, so I do a lot of neurodevelopment and all that. And just telling families that what's happening is normal, like babies behave in a certain way, or toddlers behave in a certain way, or sleep is a certain kind of it works in a certain way. So I think that also that understanding normality usually is very clarifying for parents. Oh, okay, so I shouldn't be worried about that. No. And sometimes it's just the information that they are seeking for. So they contact me for many reasons, not just the sick ones or the very difficult ones. I also see these parents that might just need a little bit of support or like encouragement or understanding. And I love that kind of assessments as well. I love the happy ones. I love the ones that end really good and they don't need me anymore. No.
Yes, I can imagine sleep is a common thing, because I got told that a lot. Like, the baby's waking up all the time and saying it's because you're breastfeeding. If you give them formula, then they would sleep better. Do you have any thoughts about that?
Oof, that's the question of the year. That's the one that and it's a quite difficult answer. First of all, is understanding what's normal sleep in babies and when do babies should or we expect them to sleep longer. And what happened is very interesting, because many of the things that they used to recommend around the 50s and 60s, 1950s, 60s, was related with this conditioning, like the psychology conditioning and training of the baby and making them do whatever the adults wanted them to do. So a lot of the sleep research came from that time. Like, they did an observation in babies that they were able to sleep through the night when they were 3 months. And when you go deeper to that research, there were babies that were bottle fed, and they were like, everything was measured. So babies were put to sleep, and then just, I can't remember exactly, but it was around 1/3 of the babies of this particular study that were able to sleep apparently through the night, but it wasn't through the night. It was from 11 to 6.
Oh, okay.
11 p.m. to 6. So that was the results of that research. And then someone got that information and started saying, oh, babies from 3 months old, they can sleep through the night. And then they conversed like completely the information. And then obviously families were told that babies, and then at that time, and that's very interesting as well, in the 60s and 70s, they started to realize, oh, every baby has insomnia. My goodness, this baby has insomnia, so we need to do things about that. And they started to do things to solve a problem that wasn't a real problem. It wasn't a problem until someone else told them that it was a problem. Because when you go back anthropologically talking about, like, babies used to sleep with their families. As mammals, we used to sleep in a very close place together with our moms, and families used to live in places all together. It was an architectonic changes, it was a cultural change, it was environmental change, it was apparently science and all that that started sleep to be an issue in every baby. So it has been very difficult to tell families that all that they have heard and all that they have suggested to do usually is not nature, is not anthropologically expected in a baby. So when you tell a family it's normal that your baby will wake up through the night, they say, but I want them to sleep through the night. Yes, I know. Me too. Both my children didn't sleep through the night until a long, like 2 years old, and my daughter, like, maybe until now.
Yeah.
She still doesn't sleep through the night. But then those difficulties are not a real problem until you see them as a real problem. So I think that that's the most important part of it, is showing families and families to understand what's the biological norm, what should you expect about that. And we have this normality as adults. Some adults might need to sleep 10 hours, some of them might need to sleep 6. So you have a 4-hour gap in between them. Who is doing things correctly? So no one, if you're happy and sleeping. So that's what really matters, no? What happens the next day? The same for babies. So don't expect much until they are older. Usually sleep matures around 3 to 5 years old. There are still night awakenings throughout those years. And what varies is what we do to cope with that. And if a family has support from the partner, from grandparents on the weekends, from someone that comes and help in the morning, so there are many other ways to cope with these difficulties. And obviously, if this is outside of the normality and you have a baby that never sleeps or a baby that wakes up 6 times through the night, maybe those babies might need expert support and understand what can be happening, which are many variables that can be happening, no? From allergies to gastric things to apnea to hay fever. I don't know, so many.
Yeah. No, I think that's truly reassuring to hear that. Just I went down again, I've done an episode about baby sleep because my son, yeah, he's kind of sleeping now at 3.5, but and my second is also a really bad sleeper. Or well, like you just said, a normal sleeper, which is really bad. But and I went down this like, dark rabbit hole, and you see so much stuff on the internet that says, 6 months old, you put them in their own room. If you feed them overnight, you're creating a sleep association and you're making a rod for your own back, and they're waking up because you've trained them to wake up for the, and when I was sleep deprived and a new mum and like quite vulnerable, really, and desperately searching for an answer, all this went in, and I was like, oh, like I felt terrible, and I was doing something wrong, and I didn't really have any other way of getting him back to sleep without the boob. And every single sleep hack book or app or whatever I tried, it was always about, no, you've just got to pat them on the bottom, and or get dad to put them down so they don't smell the milk, and none of it ever worked.
Yeah, none of that works because it's not the biological norm for babies. And they don't read the book.
Yeah.
They don't read the actual book. They've read the millennium anthropologic genetic things that they inherit from our past, and that's what they know. So they come with some instructions, but we are sometimes unable to read those instructions.
Yes.
And yes, it's a multi-billionaire industry as well, the sleep industry. So it makes it really hard for parents. And as you said, it connects with guilt. It connects it. It's something that I'm sure doing wrong. This shouldn't be as bad. And yeah, it's really hard.
Yeah. I just want to, talking about sort of stuff that you see on the internet, there's quite a lot of nonsense out there. I mean, there's lots of good stuff as well. It's, there's some great resources, but there's also a lot of nonsense on social media. Is there any just common breastfeeding myths that you kind of commonly encounter?
It's very interesting about the myths because myths depend on the geographical area that you live.
Okay.
So you can add different myths, and it's very common that in some populations there are like much more myths than in others, and that's very interesting. And well, there are many, 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 but one of them, it's interesting, the diet. No, you don't need a particular diet. First of all, to have more milk or to have a better milk or increase your milk supply. Nothing really impacts that. Only a good baby that's feeding and emptying the breasts adequately. Usually that is the norm and not any other food. So a mom that has difficulties with milk supply shouldn't waste time trying to eat different things to increase the supply. They should seek for support early. The other thing is that colic, like you can't eat certain things because they will impact the baby and may have colic or reflux. That doesn't happen either, and that depends as well in the geographical area that you live. So I don't know, in certain areas, for example in Mexico, we culturally eat beans, and then they will tell families that they are unable to eat beans because babies might have colic. And then, or that you need to eat beverages of corn. And it's good, like if you like it, but it will not increase your supply. And then you have grandmoms pushing moms to drink atole, and they don't like it. So, and it is very high caloric beverage as well. Or there are many, like not allowing to be cold on the back, so they need to cover their back because that will impact the supply. So there are many things. I think that the more you struggle with a thing, the more information or wrong information myths may have around.
My mum always tells me that she got told off on the ward after I was born because she was eating an orange, and they said, don't eat an orange, it will affect the flavor of the breast milk and the baby won't like it. So
Yeah.
does food affect
There's
the
an
flavor?
interesting research about that. Yeah,
Was it?
it does. It does,
Yeah.
but positively. I don't know if oranges in particular, but there was a very interesting research. They do like a double blind. It means that moms will not know what they're taking and doctors will not know what they were taking. And they gave moms like this capsule with garlic, so they didn't know that they were drinking garlic
Yeah.
or eating garlic. And they noticed that babies enjoyed when the moms were having the garlic. They increased the time that they were at the breast and they loved the milk with that flavor. And that's super interesting because your milk does changes the flavor with time, changes the flavor during the day, changes the flavor depending on what moms eat. It's not that it will if it tastes like orange, not like that,
Yeah.
but it can change a little bit. But that is quite interesting because it allows babies to be introduced with different flavors throughout the first 6 months of life when they haven't introduced any other food. And when you have a baby that is breastfed and then you introduce solids, they are much more happier with that. They accept better different foods. So that's also a positive thing about that.
Oh, that's so cool. I had no idea about that. So they're actually getting little flavors of whatever. Right. Yeah. I mean,
Yeah.
I'm with babies on that. I mean, there's no such thing as too much garlic. I mean, I think I would be. That's so funny that I can't believe they love the taste of garlic. And the other thing I heard a lot is about oats. That seems to be like a common thing. I think in the US, UK is you got to eat oats to maintain your supply, and you definitely can't like lose weight, so otherwise you're going to tank your supply. And I felt bad
Yeah,
when I heard
yeah,
that because there's
and
some people who just
nothing.
lose
Yeah.
weight breastfeeding. I know there's definitely some people who don't, and again, it's wrong to tell people, "Oh, you'll lose weight breastfeeding," because you might not. But also, I don't think you should. I'm guessing you shouldn't worry if you do lose weight while breastfeeding. It's not going to damage your supply. Is that right?
Exactly, exactly. Like the natural, and another very interesting thing about that is that moms during pregnancy increase their fat. Obviously, they increase their fat in their body, and the fat is increased in certain areas of the body, which is like the center part of the body. After birth, the fat that sheds first is the one of those areas that increase the deposit during pregnancy. So there are some receptors on those areas that are more active during the postpartum period. So that is also associated with a reduced risk of cardiac risks in the mom because they reduce fat in these areas that are much more risky to have later on. So it helps. What you were telling about the weight, usually you have like in between 6 months to 1 year to get to your previous weight. So it can take long. Obviously, there's this fat stigma and all of those kind of things that it's another topic completely. But it gets again here, no? So you have time to get back to your usual weight, and you can do. The ideal is to eat varied food, to have different things, to have. Obviously, eating oats is great if you like them.
Yeah.
You're not gonna eat oats like for breakfast, lunch, and dinner if you don't like it. You can if you like them, but that's the thing about the diet, that it should be varied and with fruits and vegetables and things like that. But we shouldn't tell moms what they should eat. It should be culturally accepted. It should be economically accepted as well. What if we say, no, salmon is the
Yeah.
best food you can, and your omega-3 will increase like to the roof?
Yeah.
It won't happen. So yeah, having that evidence about the things that we should recommend to families is very important.
Yeah. No, I like that a lot. Yeah, it's nice because I think it's again, it's like a very vulnerable time, and every mother has this idea that you want to do things as best as you can for your baby, and whatever that is for you. And it's a time when if you're exposed to social media and do X, do Y, and you feel like you're so yeah, that's reassuring to hear. A bit of normality, bit of common sense.
Yes, completely. Yeah, and there are many websites that are evidence based that I recommend. There's one that's Australian. It's called Kelly Mom,
Mhm.
and I love Kelly Mom because it has a lot of good like information about, can I dye my hair? Can I do whatever like with my, can I put Botox, for example, and all that. So I think this kind of websites are very important for that kind of things as well.
Oh, that's good to know. I'll try and put a link to that. I'll find it and put it in the show notes. I think that was all the questions I had for you. Is there anything else that you'd like to talk about? Anything you think is important that we haven't touched on? There's so much. I feel like we could talk about this for
I don't have,
hours.
there's so many things. What I would say as a final message maybe is that there is support for breastfeeding, there is support for parenting. I think that sometimes we don't know where to go to find this place. But one of the things that works the best is having a group of people. So having other moms, so that's why the NCT groups work so well, and these breastfeeding groups work so well, and music classes for babies. No, so get out there, get with other families, share with others, because I think that that's the way to cope better with this period of life, looking at others that may be having the same journey as you know.
100%. I think, I don't know, you'll tell me whether this is true or not, but it's sort of saying the same thing, but it was saying that the biggest indicator for whether you breastfeed or not is whether you were breastfed or you were sort of exposed, to people who were breastfeeding. So it's obviously there's that community, it instills that idea. And I know that globally, breastfeeding variation is completely different country to country and culture to culture. So yeah, I think the community that you're part of really influences that, and guessing that's how much support you get and help, and sometimes not, the formal support, but just having a friend who says like, oh right, yeah, you know what, just shove the baby up a bit more, that'll be. do you think that's true, or I'm just making stuff up?
Absolutely. Absolutely. It's anthropological. And something interesting about any action that we do as women, no, like breastfeeding is not a thing that we are born knowing how to do. It's something that we learn. We learn in the community. And there are some parts of the world that the bottle feeding is like the natural way to feed. Sadly, the UK is one of them, because the majority of women are not able to breastfeed. Are not able because they don't have enough support. I mean, they are able, but they have all those difficulties. So it makes it very easy not to see women breastfeeding. So we have our girls not looking at moms breastfeeding. We have our boys not looking at breastfeeding moms around. So breastfeeding in public is a way to help families to understand that that's normality, and that's that not what should happen, but that what can happen. And as social persons, social mammals, as we are, it is also known. There's I don't know if you have heard about that. There was this orangutan in one zoo, and she had a baby, and she wasn't able to breastfeed that baby. And this orangutan was born in the zoo. She lived in captivity. So when they realized, the scientists around her realized that, what they did, and that's in the news, you can look on internet, it's really, really interesting. It was in Ohio in the US. They invited a woman from La Leche League to sit down inside a cage of this orangutan in captivity with her own baby and feed the baby. And then that incredible animal saw that, grab her baby and start feeding the baby.
No way.
Because she didn't know how to do it. And that's incredible about us. We learn and we understand what we see, also what we are able to have the opportunity. So obviously, if our friends never breastfeed, and I always ask the families that I see, who is around you, how was your own journey where you breastfed? And it's not that it's the only way, but definitely it impacts, because if we have a grandmother that will say, I had a difficult journey but now it's different, or I can support you, it's very, very different than that grandmother will say, don't worry, you were not breastfed. No, and then you need to continue life. Well, yes, you will, but if you want to breastfeed, you should look for the appropriate support in a timely manner. I think that that's the most important part, because there are many things that we can do to support these families.
That's lovely. Oh, thank you so much, Mariana. This has been really interesting. I love that story about the orangutan. I'm going to go look it up and learn about that.
I love animals. That's my favorite.
No, this has been really interesting, and I hope it will be really helpful to anyone listening and who's maybe pregnant and thinking about whether they want to breastfeed or not, or struggling with breastfeeding at the moment. This has been so great. Thank you for taking the time out to join us. The Global Breastfeeding Clinic, I'll post in the show notes a link to that if you wanted to get in touch with Mariana and make an appointment or speak to their team. And thank you so much for listening to today's episode. And if you wouldn't mind following the show, 10,000 Steps with Baby, and following us on Instagram as well, that would be great. All right. Thank you, Mariana.
Thank you very much, Rachel. It was a pleasure to be here with you.